Hi, I'm Dennis Wagner, the Acting Director of the Quality Improvement Group here at the Centers for Medicare and Medicaid Services. Thank you for your interest in the Quality Improvement Organization program and our progress report for this year. 2014 has been a pivotal year for the QIO program. We've implemented major structural changes that we believe are going to have a significant impact on the results that we seek to generate for the American people. This report is going to give you an overview of some of those changes, some of our early progress and wins in the first 5 months of our work together, and anticipated work for the year ahead. One of the major changes in organizational structure for the newly revamped QIO program are separating the two key functions that QIOs have traditionally played. That is the beneficiary and family-centered care function of hearing and resolving and investigating complaints from consumers and others, from the Quality Innovation Network function of providing quality improvement support to organizations such as hospitals, physician practices, home health, long-term care, and others. Separating these two functions is enabling the QIO program to provide cleaner, clearer, more straightforward services to each of these key constituencies. This is already enabling us to achieve our principal aims of better care and better health at lower cost for the American public. I want to take a few moments to highlight some of the successes that QIOs have contributed to over the course of the last several years and the last several months. HHS Secretary Sylvia Matthew Burwell announced major improvements in patient safety, reductions in harm, as part of her keynote speech at the December 2014 QualityNet conference. Secretary Burwell highlighted 4 key numbers that illustrate the tremendous accomplishments that QIOs have contributed to. A 17% reduction in overall harm from our baseline year of 2010. This translates into 1.3 million fewer patient harms, an estimated 50,000 lives saved, and $12 billion in cost savings. These are unprecedented national results, and QIOs have been at the foreground of generating these results in partnership with hospital engagement networks, with aligned private partners, with aligned federal programs. We're grateful for your contributions to these life-saving results. Great going. I'd like to highlight some additional successes. Beneficiary and family-centered care QIOs are teaming aggressively with state hospital associations to get the word out to beneficiaries about the services that they provide. Similarly, Quinn QIOs are teaming with hospital engagement networks and others on work to reduce 30-day readmissions. Some dramatic examples of success are occurring in this area in the states of Washington and Minnesota. Thank you for those results. There are many other partnering efforts that are going on with the Centers for Disease Control and the Million Hearts campaign, with the Advancing Excellence in America's Nursing Homes, where QIOs are leading the way in partnering with others. Thank you for these powerful partnerships and your work to collaborate with caregivers across the country. Although our structure has changed, our commitment to putting patients first and driving change to achieve better care, better health at lower costs is rock solid and remains the same. QIOs are ideally positioned to lead the integration of American healthcare across provider types, from physician practices to hospitals to long-term care to home health. We're calling on QIOs to lead on this important integration work. Patients need providers and provider organizations that work and talk and team together at the community level. We trust that you will find this report useful and engaging, and we urge you to share it with your partners and your stakeholders. Thank you for your work and service to the American people.